Hello, everyone. Welcome back to WUT News, your trusted platform for powerful, educational, and life-changing information. Today's topic is one of the most common yet least understood infections in the world, HPV, human papillomavirus. You may have heard about HPV before, but do you really understand how serious it can be? Did you know that HPV is responsible for the majority of cervical cancer cases worldwide? Or that millions of people are infected without even knowing it? This is why today's video is extremely important. In this complete guide, we will cover the history of HPV, what exactly HPV is, how it spreads, symptoms and complications, countries most affected, prevention methods, protection strategies, vaccines and treatments, and many more essential facts. So make sure you watch this video until the very end, because this knowledge can protect your life and the lives of people you care about. Section 1. What is HPV? HPV stands for human papillomavirus. It is a group of more than 200 related viruses. Some types cause harmless skin warts, while others can lead to serious diseases, including cancer. HPV is mainly categorized into two types. Low-risk HPV causes warts, especially genital warts. High-risk HPV can cause cancers such as cervical cancer, anal cancer, throat cancer, penile cancer. HPV is extremely common. In fact, most sexually active people will get HPV at some point in their lives, often without knowing it. Section 2. History of HPV. The understanding of HPV has evolved significantly over time. In ancient history, warts were recognized but not understood. In the 20th century, scientists discovered that viruses cause warts. In the 1970s and 80s, researchers identified HPV as a major cause of cervical cancer. One of the most important breakthroughs came when scientists proved that certain HPV types are directly linked to cancer development. This discovery revolutionized cancer prevention, screening methods, and vaccine development. Today, HPV vaccines are one of the most powerful tools in preventing cancer. Section 3. How HPV spreads. HPV is mainly spread through skin-to-skin contact, especially during sexual activity. Common ways HPV spreads include vaginal, anal, or oral sex, genital-to-genital contact, even without penetration, and sharing of contaminated objects, rare. Important facts: HPV does not require ejaculation to spread. A person can spread HPV even without symptoms. Condoms reduce risk but do not provide 100% protection. HPV can infect anyone, men and women alike. Section 4. Symptoms of HPV. One of the biggest dangers of HPV is that it often shows no symptoms. However, in some cases, low-risk HPV symptoms include genital warts, small bumps in genital or anal areas. High-risk HPV symptoms usually no early symptoms. Later stages may lead to abnormal bleeding, pelvic pain, or unexplained weight loss. These symptoms often appear only after serious complications like cancer develop. Section 5. Countries most affected. HPV is a global infection, but its impact varies. Developing countries have higher rates of HPV-related cancers. Sub-Saharan Africa, South Asia, and Latin America report high cervical cancer rates. Limited access to screening and vaccines increases risk. Countries with strong healthcare systems and vaccination programs have lower HPV infection rates and reduced cancer cases. This shows the importance of awareness and prevention. Section 6. Prevention methods. Preventing HPV is possible and highly effective when proper steps are taken. Number 1. Vaccination. HPV vaccines protect against the most dangerous types of the virus. Recommended for young people before sexual activity, also beneficial for adults. Number 2. Safe sexual practices. Use condoms, limit number of sexual partners, maintain healthy relationships. Number 3. Regular screening. Pap smear tests for women, HPV testing.
Early detection can prevent cancer. Section 7. Protection strategies. Protecting yourself from HPV requires both awareness and action. Get vaccinated as early as possible. Practice safe sex. Maintain personal hygiene. Visit a doctor regularly. Education is the most powerful protection. Section 8. Treatment options. There is no cure for HPV itself, but its effects can be treated. Warts can be removed through medical procedures. Precancerous changes can be treated early. Cancer can be managed with surgery, radiation, and chemotherapy. Most HPV infections go away on their own, but persistent infections can be dangerous. Section 9. Important facts. HPV is the most common sexually transmitted infection. Most people don't know they have it. Vaccines can prevent many HPV-related cancers. Early detection saves lives. Both men and women should be aware. Section 10. Why awareness matters. HPV is not just a medical issue, it is a public health concern. Lack of awareness leads to late diagnosis, increased cancer cases, and preventable deaths. By spreading knowledge, we can save lives, reduce stigma, build a healthier society. Conclusion. Understanding HPV is essential in today's world. It is common, it is preventable, and with the right knowledge, it is controllable. Do not ignore this topic. Take action today. Get informed, get vaccinated, get tested, and most importantly, share this information with others. Call to action. Very important. If you found this video helpful, educational, and meaningful, now is the time to take one simple but powerful action. Subscribe to WUT News right now. Click the notification bell and like and share this video. Your support helps us continue creating valuable content that educates, protects, and saves lives. Remember, one click from you can help spread awareness to thousands of people. Final message: stay informed, stay protected, stay healthy. This is WUT News, bringing you knowledge that matters. Thank you for watching, and we'll see you in the next video.